during 5th year in both semesters. You will study polyclinic or outpatient therapy. On the 6th year of education, you will study general practice, also in both semesters. I'm the head of this department, Associate Professor Nikolai Medvedev. This lecture I will read for you, but next lecture, it will next Monday, same time, 3 p.m. Your lecturer will, other professor of our department, Professor Larissa Ivanovna Sveti. She will present for your attention next topic, phototherapy methods in outpatient practice. Today our lecture will consist of 2 parts. First part, more short part, will include general information or introduction about physiotherapy as separate independent medical discipline. Main principles of application, physical factors. Indications, contraindications, classification, and some other important information about application of physiotherapy in daily medical practice. Second part will devote to the explanation of different principles of main mechanisms, principles of action, medical effects, and indication and contraindications of electro-treatment, of different methods of electrotherapy, as also additional method of medical rehabilitation for correction of any disorders or even serious diseases. Now let's formulate the definition of our discipline, physiotherapy. It is the medical discipline which studies the action of natural, as you can see on this picture, natural, beautiful sea coast, sea water, clear air, natural physical factors and artificial physical factors on human organism with the medical, rehabilitative, and preventive purposes. So we can apply physiotherapeutical methods for therapy, for rehabilitation, and even for prevention of any diseases. For example, prevention of rickets by using of ultraviolet radiation and stimulation of vitamin D synthesis in our organism. What is the subject and object of physiotherapy? As you can see, subject of this discipline is different physical factors. As I said before, natural and artificial. As for object of physiotherapy study, it is the person or persons whom physical factors influence, who used these technologies in their rehabilitation and treatment, and sometimes in prophylactic. We can divide all physiotherapy discipline on 2 main parts: general physiotherapy, which studies peculiarities of physical factors and the mechanisms the operation on our organism separately in normal or in pathological conditions. And second part, which have high practical significance, or private or clinical physiotherapy which studies possibilities and methods of the medical or prophylactic application of different physical factors for treatment of different diseases. This is principal difference between general and private physiotherapy. Few words about ways which we can apply for application for operation by physical factors. These factors we can use through skin, mucous membranes, tissues and organs projection, and by central nervous system activation of central nervous system, or directly. Now let's illustrate main stages of physiotherapeutic process or influence on our organism. Three groups of reactions we can reveal and describe in this process. First reaction is physical changes, second is physical and chemical, and third is biological. Biological changes we can divide on local reactions, reflex, segmentary reactions, and the general reactions of a whole organism. As for physical and chemical stage, this stage includes formation of heat in tissues under action, for example, electromagnetic field, change of ions concentration under the electric current influence, generation of free radicals, change of biopolymers conformation, change of physical and chemical properties of water as most widespread element and electric conductor in our organism. Now let's discuss main reactions of our organism under the influence of the different physical factors. How our organism can which reaction of our organism? We can divide all reactions on two parts, main parts, general, three parts you saw before. First is general reactions, anti-inflammatory effect, analgesic, desensitizing, or decrease sensitivity to, for example, for any allergens, spasmolytic, improvement of blood and lymph circulation, immunocorrection. All these effects are general reactions. As for local reactions, there are rising of temperature, local temperature, change of pH parameter, anosmosis, and ionic structure changes, stimulation of ionic exchange between cells and external membrane, and allocation or the releasing of biological active substances by cells. And maybe possible local blood circulation changes, microcirculation changes, or capillary blood flow. Now I'll enumerate main advantages of physiotherapy as independent discipline, or in comparison with other methods of treatment, modern diseases. Methods of physiotherapy can provide universal effect, despite on mechanism of etiological factors, mechanism affections. So physical factors can stimulate universal mechanisms of recovery in human organisms. So we can apply these methods, this group of methods, for different groups of pathological disorders and diseases. Also, one advantage of physiotherapy is the long period of an after action. So maintenance, by other words, long maintenance of therapeutical effect due to long function of responsible adaptive mechanisms of blood circulation or hormone releasing. Under the influence of these adaptive changes, we can activate by using physiotherapeutical factors. Other, of course, important advantage is compatibility with other medical methods in therapeutical program. Good compatibility, for example, of drug treatment with, for example, inhalation procedure for patients with COPD, or also injections with physiotherapeutical application of electromagnetic fields or magnetotherapy for patients with joints problem, with arthrosis, arthritis. Availability for majority of people, because these methods are usually not expensive, and so relatively more cheap than new modification, new generations of modern medication, and of course surgical treatment. Else one serious advantage is absence of medical dependence. This dependence, as you know, is typical for application of any drugs, especially analgesics, especially opioids. Other next advantage, especially very high for child's painlessness. This method, some methods, almost all methods of physiotherapy we can apply without any unpleasant sensations, and of course without pain. And these methods are physiological because their action associated with soft influence or non-aggressive intervention. As you can see here in the bath, even hydromassage is not aggressive. It's more pleasant than aggressive. Now let's enumerate main principles and let's discuss main principles of physiotherapy, which we can apply, which we should know before prescription of concrete program, including physiotherapy. First is application of small doses. When we will prescribe any physiotherapeutic method, we will use firstly minimal physical characteristics, frequency of fluctuations or intensity of current for electrotreatment, and minimal duration of UV ray radiation. These small doses can help to achieve